call the Personnel Committee meeting to order. I don't believe either of my colleagues, Mr. Zine or Mr. Parks, are going to be able to attend today, as I understand it. So everything that is approved will be a recommendation of the chair. If we could, let's see, item number 2, I believe, is going to be continued. And so if we could start with item number 1.
For item 1, the Community Development Department has submitted a report relative to the third-year extension of civil service exemption for various grant-funded positions in the department.
Good morning, Mr. Chair. Rhonda Gassner
Good morning.
with Community Development Department, and joining me is our new personnel officer, and
Deetra Fernandez.
Welcome.
before you this morning is a request to continue the council resolution exemptions for 17 positions related to our Workforce Investment Act programs. Primarily, the positions are for our Youth Opportunity Movement program, and those are our direct service providers that actually operate the city's summer youth employment program. And then we also have some administrative staff positions there. The positions are now in their third year of the council resolution, and we're just asking that those positions be continued this year. They're included in the department PAR.
And why the exemptions in the first place? Why these positions?
They are fully grant funded with WIF grant dollars from the Department of Labor. So under the grants ordinance, we're allowed a one-year exemption with renewal for 2 years thereafter. But these positions, because WIA money is pretty much longstanding in the city, they have been around for a substantial number of years, maybe beyond the 3 years, so we come back every year for the extensions.
Okay,
But
and
they are fully grant funded and fully burdened with related costs and everything.
these are primarily youth-related positions.
Correct. These staff actually operate the summer youth employment program for the city, as well as other direct services throughout the year that are funded in the WIA annual plan.
Okay, well, sounds good. I'll recommend that we approve the department's requests.
Thank you.
Actually, my first job that I ever had was as a summer youth program supervisor, so it might be the same positions.
Okay, thank you.
Thank you. Item number 3.
For item 3, the Personnel Department and the Joint Labor Management Benefits Committee have submitted a joint report relative to fourth-year contract extensions with various providers for the Civilian Modified Flexible Benefits Program.
Good morning.
My name is Stephen Montagna, and I'm here to represent the Personnel Department. So what I'm going to do is just to briefly go over the recommendations that are contained within the report. One recommendation would be to have the City Council formally give approval to the 2012 Flexible Benefits Plan. The second action is we're asking that the council give approval to a number of contract extensions, which will involve taking their contract terms past the customary 3 years and into a fourth year, which would conclude at the end of calendar year 2012. The reason for these extensions is basically that right now the JLMBC is looking at certain potential possible changes that would be made to the plans. They recently issued a request for information, and they're waiting to receive the results of that. And once they have that and can incorporate that into the design of the RFPs, then they'd like to issue those RFPs at the end of this year, which would mean that once they run through the process, that the new contracts, those would be effective in 2013. With that as sort of an introduction, let me just sort of briefly go over some of the highlights of the recent JLMBC actions, which have resulted in reductions in overall expenditures for the benefit programs in 2012. Oh, I'm sorry. All right, thank you. So first, the first thing, as noted on page 3 of the report, one of the things that the JLMBC has done is continued a long-term practice of negotiating with the healthcares to be able to lower the premium costs. So over the past 4 years, this has ranged anywhere from a 3.5% to almost 25% reduction in the actual premium increases versus the amounts that were originally proposed by the carriers. The other thing that happened more recently with the JLMBC was that they implemented a number of changes to the plan design, including increases to employee copays, which have helped to lower the city's costs. And for the second half of this year, we are projecting that's going to result in approximately $6.4 million in savings. The last piece is that the JLMBC has implemented a wellness program, which in their view will hopefully help to lower long-term costs by encouraging healthy behaviors. On the contracts, what the JLMBC is recommending would be extension of all of the health plan contracts, which that would include the Kaiser contract, as well as the Anthem HMO and the Anthem PPO. They are also recommending extension of the Delta Dental contract, and the last 2 contracts would be the contract with the provider to provide AD&D coverage, as well as the contract that we have to handle the administration of our tax-favored reimbursement programs.
Anything else in your presentation?
Good morning. Thank you. I'm Cheryl Parisi. I'm the co-chair, along with Maggie Whalen, of the Personnel Department of the City's Joint Labor Management Benefits Committee. As you're probably aware, the Joint Labor Management Benefits Committee is a unique committee in the City of Los Angeles, in that it is a co-equal committee made up of an equal number of union representatives and management representatives to come together to make collaborative and consensus-based decisions about health care, the provision of health care for workers in the city of specifically the civilian population of the city of Los Angeles, excluding Department of Water and Power. And over the last few years, in response to the city's overall financial challenges, as well as to the escalating cost of health care, we've come together to try to really try to achieve a balanced approach. I know that's an overused word these days, but truly that's what's happened. There certainly is a significant amount of worker sacrifice here in terms of increased copays, both on the office visits as well as drug copays. However, that has been coupled with a very assertive approach to negotiating with the healthcare providers. We took the position that we needed to be very firm. Oftentimes, healthcare providers would sort of come in and give us a take it or leave it attitude. The committee really took a position that we needed to really establish relationships whereby the providers would partner with us. And as you can see by the track record here, we've been able to drive down overall costs. One of the unique things that we were able to achieve specifically with Kaiser and Blue Cross was to have them recalibrate or recost the health plans based on the impact of the early retirement program, because the early retirement program obviously significantly altered the demographics of the employee base. And we prevailed upon both providers to, contrary to their practice, to really sort of re-look at and reanalyze the impact of that changed demographic on health plans. And as a result of that work, we're able again to drive down overall premium increases that were sought from the providers. And so we've really attempted to work on that side, as well as you can see the sacrifice made by workers in terms of increased copays. This work obviously has paid off, and that you can see the long-term savings over the next 5 years is over $100 million. It's real and significant. We're asking that you extend the contracts through the end of 2012 so that we can go out to RFP for plan year 2013. And let me say the purpose of that is not to engage in further cost shifting, further copay increases. That's not the goal. The goal is really to have the industry come back to us to be able to share best practices and best ideas in terms of the design of health plans so that we can really make our decisions in light of some of the best practices and new innovations in the provision of health care. And that is really the goal as it pertains to the RFP. So again, we're asking that you would extend the plans as requested through the end of Plan Year 12 and allow us the opportunity to work creatively and hopefully come back with new and better innovations for Plan Year 13.
Actually, I'm surprised to hear that we had to push the insurance companies hard to accept the age changes, because health insurance is so age-based, and to take off all of your oldest employees, or a huge chunk of your oldest employees, should drop their costs dramatically.
Well, it was a question of when they were going to take the savings, and so we really pushed them to record those savings earlier. So we got the advantage, in an earlier plan year.
As they should, so that's good to hear. What was the impact on employees? What did they give up as a result of this deal?
The HMO copay went from a $10 copay, which was adopted probably 15, 20 years ago, to a $15 copay on the HMO plans. That copay is consistent with the copays under the CalPERS health plans, which provide health care to hundreds of thousands of public employees throughout the state of California. And on the PPO plan, which is the much more expensive plan, the copay went from $15 to $30. And then there were graduated increase in copays on the drug side based upon the use of generic versus formulary, generic versus formulary versus non-formulary. So kind of 3 different levels there. So those are the 2 areas. The labor side of the Joint Labor Management Committee has been and continues to be committed that the policy of the provision of health care would provide for full family coverage in an HMO plan for all city workers, and we've obviously been able to continue to achieve that baseline.
Okay, and I think the Delta Dental plan has changes mid this year. What were those changes?
There were some changes as it relates to the Delta Dental. I'm trying to.
Well, the additional contribution, or a contribution that employees were no longer paying towards that. Now they have a monthly contribution of $7.48, I believe, is the amount. So.
And I don't know if this is a result of something new or not, but I've gotten a couple complaints from people that had major dental work and found they had a very large nut to crack of their own as part of that. Is that a newer expense, or has that been a fact all along? So if you had an example of one person I know had a $10,000 expense and they had to pony up $3,000 of that themselves. Is that because of a reduced coverage, or has that been the way all along?
That's been the practice all along. There's a yearly maximum, and so unless I mean, on a practical level, just as a user of dental plans, you should try to if you're doing major work, kind of balance that over a 2-year period, because if not, you can easily go over the maximum allowable, and then the rest is out of pocket. And so sometimes people who have very high levels of usage of their dental plan in 1 year will have quite a bit out of pocket because of the maximums. But that's been a long-standing term of the policies and is consistent throughout.
So to the extent that you can manage that, if you need a bunch of crowns or whatever it is, ideally do some of them in 1 year and some of them the next year to
That's the practical.
not wind up paying for most of it yourself.
Exactly.
Okay, so that's not a new
No.
a new change. Have you heard any complaints from employees about the changes? They don't seem that dramatic, but have people been feeling it and complaining, or no?
Well, I mean, we shouldn't minimize it. I mean, these are additional copays. I did not mention one, which we think is important. We moved the emergency room copay to use of emergency rooms to $100 an incident, and quite honestly, there was a reason for that. The City of Los Angeles continues to have a disproportionately high number of our members who seek care through an emergency room, and as of course, if you know, that's the most expensive way to achieve care. And as a matter of law and practice, all HMOs are required to provide same-day appointments, and so we really want to encourage members to utilize the practice of achieving same-day appointments and only utilizing the emergency room when absolutely needed.
I think that's a very good idea, and we know just from a broader policy goal that emergency rooms are overcrowded because too many people are using them for primary care. So anything we can do to change that policy is probably a good idea. And anything less than $100, it almost is like an office visit. It's not much of a deterrent. So I think that's a good idea.
Again, both of the HMOs, again, it's a matter of law that was recently adopted, are required to provide same-day appointments, and so we think that mechanism will ensure that people not go without care, which is not the intent, but to just try to achieve care in a more cost-effective way.
Well, I would be ready to approve the recommendation. I have to ask the city attorney a conflict question that just occurred to me. Since Kaiser is among them, even though this is a pretty routine item, and since my wife works in community affairs for one of the hospitals, does that create enough of a conflict for me to not be able to vote on that?
That really is a question for our public integrity unit, but I would say based upon my knowledge that there could at least be an appearance of bias, and so what you could do is just forward it without recommendation, since you're the only one here today.
I guess I would forward the rest of it, the other health plans, with my recommendation, and
If you want to divide it.
and forward the Kaiser one without my recommendation due to a conflict. So it's clear it's not because it's something bad about the Kaiser plan, but I have the same concern that I probably shouldn't vote for that for appearances purposes. And so we will do that. And thank you. Item number 4.
The Personnel Department has submitted a report relative to consolidated reasonable accommodations for employees with temporary and permanent work restrictions as a result of industrial or non-industrial injuries or illnesses for the second and third quarters of fiscal year 2010-11.
Hi, I'm Michael Gold with the Personnel Department.
Dave Noltmeyer, Personnel Department.
Okay, so this report covers the second and third quarters of the most recent fiscal year and compares those quarters to the same quarters of the prior fiscal year. Okay, so with our workers' comp portion of the report, we're looking at employees with industrial injuries or illnesses. We're tracking the light duty hours that they've worked, the amount of injured on duty or IOD dollars saved, which is those light duty hours times the employee's salary, okay? And then we have IOD dollars spent, which is the money paid when the employees are at home and can't work. So in the report, in the first attachment, page 1, the second quarter total for light duty hours worked, 117,000, that's up 8% from the prior fiscal year. The IOD dollars saved at 4.6 million is up 16% from the prior year, and IOD spent in the second quarter is $11.7 million, which is up 15% from the prior fiscal year. And on that same attachment for the third quarter, light duty hours were at 147,000, which is up 17%. IOD saved was at 5.7 million, which is up 24% from the prior year. And IOD spent was at $12.6 million, up 11%. Okay? So I'll move to the second portion of the report, which covers employees who request reasonable accommodations. We break that into two different parts. We have attachment 2 shows the reasonable accommodations requests granted and denied and pending within or throughout city departments. So we have those numbers in attachment 2 for the second quarter, and then attachment 3 shows those numbers for the third quarter. And then finally, we have the citywide placement efforts for employees who could not be accommodated in their own departments, and they get forwarded to the personnel department, where we have a program to place employees in whatever city department we could find a position for them. So attachment 4 shows the activity in the second quarter, and attachment 5 for the third quarter.
I'd like to have a little more comprehensive discussion about the report. So starting with the most basic, what does light duty mean and how does it relate to temporary modified duty?
Light duty is actually tracked in the payroll system, and that is where if somebody would have a restriction, which would be like a temporary restriction from the workers' comp claim, but the department is able to accommodate it. And so that is actually productivity saved, which is tracked in the payroll system. Because if the department wasn't able to accommodate, or we couldn't accommodate them in a citywide search, they would receive their injury on duty pay, but they would get no productivity out of them.
And how does that relate to temporary modified duty?
It's one and the same.
Okay. And what does injured on duty saved and injured on duty spent mean exactly?
Injury on duty saved is where you are accommodating that light duty restriction so that the person is actually working and you're getting productivity out of them. Injury on duty paid is when you are not able to accommodate the restriction and they are at home receiving their full salary.
And how does the number of light duty hours worked affect the number of IOD saved and spent?
It's correlated. So you're seeing how many light duty hours a person worked, and that light duty saved is their hours times their salary rate.
And what's the significance of these numbers rising from one year to the next?
Well,
Are there things that we can extrapolate from that and things we could be doing to improve our circumstances?
Absolutely. You want to focus in this area to see that departments are actually accommodating restrictions when they can, so that you get the productivity out of them. If you don't focus in this area, there's no incentive for departments to look to see if they can accommodate these restrictions.
And overseeing this, are we finding that all departments are doing a good job of this? Are there some that aren't accommodating as well as they should?
Well, on the accommodation side?
Yeah, for the accommodations, in the last 4 attachments, really most of the departments are doing a pretty good job. Where we look is in the pending column on attachment 2 and attachment 3, and where we see large numbers, we talk to those departments and find out what's happening. Why are so many people pending and not being accommodated? But what we're finding is that those large numbers are generally the larger departments. So fire department, sanitation, police, and water and power. So we're not overly concerned because we expect those departments to have more pending. But this report allows us to ask those same questions of those departments. And we find that as we keep asking, those numbers have been going down.
So the fact that those numbers stick out is just a reflection of the size of the departments rather than them not doing a good job.
Yes.
But you're on them and encouraging them to close these cases.
Yes.
And what exactly is the city's obligation in terms of reasonable accommodation?
Well, if there's an employee with permanent work restrictions, then we're obligated to sit down with that employee and talk with them in an interactive dialogue, find out what their restrictions are. We need to look at positions that we have available that could possibly accommodate their restrictions. And if there's something reasonable that we can do, we're obligated to find them that position and put them back to work.
Now, if they're in a position where they're paid $100,000 and the logical position that they could continue in pays $30,000, do we pay them their old salary, the current level salary, or do we pay for a while at the higher salary and switch to the low? How do we do that?
If somebody is transferring to a new position where they'll be performing different duties, then we pay them at the salary of the new position. Usually the salary cut isn't as dramatic as what you're saying. We try to find positions
Right, I'm just
that are
giving you
closer.
an example off the top of my head.
Right.
Ideally, you'd find something more suitable. But-
Right, exactly. But they would be paid at the position for which they're performing those duties.
And Bureau of Sanitation seems to have the most reasonable accommodation requests. Any particular reason for that?
I don't have, I think they have a lot of, probably a lot of blue-collar jobs over there that lead to injuries. They're a fairly sizable department, so I just think it's a combination of factors.
Okay. All right, well, we will receive and file this, and thank you for your report. Item number 5.
The Department of Transportation has submitted a report in response to an adopted budget recommendation instructing them to come back and report on the hiring and training plans for the part-time traffic officers.
Hi, Chairman. Jaime De La Vega, DOT. Just a brief verbal update to the memo I submitted. We currently have 47 part-time traffic officers in training. They began training last Monday. This is their second week of training, and we expect to have them in the field this coming weekend. I'm happy to answer any questions.
Well, I'm probably going to continue this item based on receiving a relatively long letter from SCIU 721, which I physically possess but received so recently that I haven't had a chance to read it yet. So I think what I'm going to do is I'm going to take whatever testimony we have and then continue this item to our next personnel committee meeting, and then we'll discuss it in more detail. Plus, I'd like to have the full committee present for the discussion.
Okay.
And I thank you for that. And now we'll give a chance for those who have put in their cards. Let's see. The first person is Charles Harrell, I believe, followed by Santa Cruz Villarreal. Welcome. You'll each have 2 minutes.
Good morning, sir. My name is Charles Harrell. 8-year veteran with the Department of Transportation. I'm here to speak on the hidden costs. There are hidden costs to the part-time employee program, reducing the cost savings of hiring part-time employees over full-time employees. The turnover in the part-time employee program will result in a loss of projected revenue during the vacancies due to employees quitting, being fired, getting injured, and additional costs in training and hiring of new employees will result. Part-time traffic officers, or traffic officers in general, are exposed to a high-stress work environment and experience mental and physical duress every day. At-will employees trying to produce high numbers of tickets will also be exposed to this, trying to produce supervisory goals and handle confrontations with the public. The tense work environment is also prone to IOD injuries, as you've heard, on the job that will result in paid absences. In addition, because of its fixed wage, the part-time position without career advancement opportunities, part-timers will leave for better opportunities elsewhere. On the other hand, a full-time traffic officer have demonstrated the long-term commitment for working for the city, and we have pride in our work. Another concern with part-time employees is the increased probability that they will write non-enforceable tickets to meet supervisory expectations and goals. The at-will status of part-time employees creates an additional pressure to meet these goals or face the possibility of termination, which is the basis of concern for ticket errors, that the ticket errors will increase and the capture rates will be compromised. The part-time employee program is created to work weekend shifts, but full-time traffic officers have the ability to work 24/7. We can supplement the schedule with full-time traffic officers, while part-time employees don't have the authority or will be equipped in handling emergencies, signal shutdowns, unusual occurrences, and special events. Traffic officers urge that the City Council make the current part-time employees full-time. Traffic officers are not in training. Those employees that are in training, to bring them on as full-time.
Thank you.
Thank you, sir.
Good morning. My name is Santa Cruz Villarreal, and I've been a traffic officer for 26 years. Full-time traffic officers have experience to implement revenue-generating ideas to increase revenue into the general fund. It is more financially productive to focus on revenue generation than establishing a part-time program. The City Controller recently released a series of 3 audits investigating the city's parking enforcement process, and it is clear that the city has many improvements to make to its parking citation and collection process, and must immediately address these challenges to both generate revenue and to make Los Angeles a better place to work and perform business, live, work, and perform business. The City Controller stated in an audit that the collection rate of the city citation program is 56%. But within these 3 audits, the City Controller also showed a potential loss of over $17 million in potential revenue due to revenue management. In addition, the city could make significant gain in revenue by improving their contracts and bringing those money management services in-house. One of those services for collecting revenue is booting vehicles, and contrary to towing them. Right now, we're towing vehicles, and the only revenue we're bringing in is $100. When we could boot a vehicle and bring in $150 for each vehicle. Abandoned sweeps would be productive because we would bring in up to $4,500 each sweep with just 5 officers. And that's only in towing the vehicles, and also we find scofflaws within it. That's not including $2,000 to $3,000 in tickets that we would get for that particular sweep. It's the same with handicapped vehicles. We would collect $353 if we bought that vehicle, that particular detail back for each vehicle that we find that have expired handicap placards or people that are using them illegally.
Thank you.
Thank you, sir.
Next speaker is Darren McDaniel, to be followed by Daryl Prince, who's our last speaker.
Good morning.
Good morning.
My name is Darren McDaniel. Sorry, a little closer. My name is Darren McDaniel. I'm a traffic officer. I've been doing my job for over 11 years. When I started the job, I wanted to help people, interact with the public, and I saw it as a way to secure my family. By hiring part-time officers to write tickets, the Department of Transportation is making it hard for me and my fellow officers to do our job professionally and honorably. Part-timers' core duty is to write tickets and nothing more. That will add to the stereotype of how the public views traffic officers as glorified ticket writers. My job is more than writing tickets. I keep the city of LA moving. I direct traffic when the streets are congested due to special events like the Los Angeles Marathon. I make sure that people get out of their driveways when their driveways are blocked by people who've left their cars unattended. In fact, I've even helped people get out of their driveways in order to go to the hospital. As you can guess, it's not an easy job. I've been spit on, cussed at, and even had angry drivers lunge their vehicles at me after discovering a ticket on their car.
I promise you to stop doing that, by the way.
I'd appreciate it. After more than 11 years on the job, I know how to diffuse a situation by showing people respect. I and my fellow officers want the department in which we work in to be a better one for workers, managers, and especially the people of LA whom we serve and protect. We don't want DOT to undermine our professionalism by hiring part-timers. Instead, we want them to be full-time officers so they can learn the professionalism that it takes to serve the people of this city. Full-time traffic officers are committed to their careers, in turn improving the Department of Transportation. The public image of the department has suffered with negative media reports, and the City Controller's Office series of 3 audits have found that improvements need to be made within the department. Full-time officers have the experience and dedication to the department, Full-time officers have the experience and dedication to the department and are better suited to work in partnership with the department to create a solution and implement them. We urge the council to make the part-timers that are currently in training full-time officers and not implement a part-time program. In
Thank you.
addition, I'd like one last comment.
Okay, one last thing.
I'd like to submit a report for the council's consideration, which highlights our key arguments against the part-time program.
And you can submit that to the city clerk.
Good morning,
Thank you.
ladies and gentlemen. My name is Darrell Prince. I have 24 glorious years of service with the City of Los Angeles. I'm here today to discuss the benefits of full-time employment for traffic officers. Full-time officers are likely to achieve the $9 million revenue projection in parking citations that more than part-time employees. We are the proven revenue-generating officers. Traffic officers generate over $165 million in collected citations, with $130 million of that amount transferred to the general fund on a yearly basis. Full-time officers know how to bring in revenue. The CEO's office originally proposed that an estimated $9 million in revenue to the general fund was based on part-time deployment during peak hour enforcement, which are typically Monday through Friday, 10:30 to 2:30, 6 to 10 p.m., and some weekends. The current proposal is for part-time employees to work weekend parking enforcement shifts that have a lower average of ticket citations per shift, that being on the weekends, particularly Sundays. Part-time employees will, current traffic officers have been told that, excuse me, part-time employees will only perform ticket writing duties, which excludes high revenue tickets such as booting, impounds, and abandons, and as well as handicap enforcement. In addition, full-time traffic officers are trained to handle situations that require access to confidential information, such as assisting LAPD officers in stolen vehicles recovery, thus allowing them to provide a better service to the citizens of Los Angeles. It takes an average of 6 months to a year to become a well-rounded traffic officer. Experience leads to decreasing number of ticket errors, increasing efficiency in writing enforceable tickets, understanding of patterns in their assigned beat areas, and strengthens the officer's ability to resolve conflicts and avoid injuries to the officer or residents, excuse me, thereby keeping the city of Los Angeles out of any potential liabilities. It will take longer for a part-time employee to learn these skills since they work fewer hours on the job. We as revenue-generating reads the revenue-generating officers of the city urge the city council to take the current part-time employees and the training full-time to full-time traffic officers and not implement the part-time.
Thank you.
Thank you, sir.
And we're going to continue this item to our next meeting, which is
August the 17th.
August 17th. And so we'll have a more robust discussion with a full complement of members then. And since there are no other items, we will now be...
Item 6.
Oh, I'm sorry. I missed an item. You're right, item number 6.
Motion introduced by Councilwoman Perry, seconded by Councilmember Reyes, requesting that the controller be authorized to work with the American Heart Association to set up a payroll deduction program enabling all city personnel to contribute to the American Heart Association, and requesting that the city attorney prepare and present the necessary ordinance.
Carolyn Cooper, representing the CAO's office. I think there were some discussions with one of the council offices. June, you can jump in if you need to, on the timing and what is being requested of the city departments to respond on this motion. And it's the city attorney and the CAO's position that the city attorney should first be instructed to prepare the ordinance as part.
Well, after the CAO has had it's usually done jointly. The CAO first reviews the efficacy of the organization to participate under Code Section 4.203, but City Council has to instruct the city attorney to actually prepare the ordinance. We don't prepare it in advance.
So then what are you recommending?
What we're basically recommending is that because there doesn't seem to be another city department doing this at this time, that the CAO determine if the organization meets the qualification to be designated as a charitable organization under the Administrative Code Section 4.203D. And I don't know then if it would go back to council before instructing the city attorney to prepare the ordinance. There was some expectation that the city attorney would have already prepared the ordinance when this item's considered, this motion, but it's premature to do that.
Correct. That's my understanding. That's usually not how it's done. And I guess there's some question, at least I'm not entirely clear, about what the criteria is to be included, whether it has to be an umbrella organization or whether as notable and mainstream as the American Heart Association is, whether that meets the qualification.
No, having name recognition isn't sufficient enough. There's actually very specific criteria that is articulated in the administrative code under 4.203 subsection D, and to be eligible to receive voluntary payroll deductions by employees, an organization, a nonprofit organization that's a 501(c)(3) organization under the IRS code, has to be an umbrella charitable organization, and there's specific criteria, and it has to be compliant with IRS codes, the state registry of nonprofits. It has to be compliant with the LAPD Commission Investigation Division requirements, and that's all articulated in the municipal code as well as in the ad code, and that is how it's set up for city employees.
And has the CAO has not yet determined whether they...
Because we haven't been instructed to do so. So that's the problem with this motion, is it jumps ahead, and it's putting, as I described it, is putting the cart before the horse, because it's basically asking the city attorney to prepare an ordinance when we have not determined, when the city has not determined if the American Heart Association qualifies. And
I guess the logical thing then would be to ask you to report back with a determination on whether indeed that qualifies and come back to committee with that. And I wonder if we could ask you to do something a little bit more, which is to give us an explanation also of what the original thinking was of mandating that it must be an umbrella organization, and whether or not that's still a current thought, and whether we might consider altering that as well.
Yeah, I'm not sure how it's the legislative history, the intent, how far back it goes, and go ahead, June.
Councilman, I'm not sure whether this is the appropriate forum to do it. I can certainly talk with Carolyn on some of the history. There is a report that was generated, I believe it was around 1992, that established the requirement that there be an umbrella organization. So rather than taking up the committee's time, it might be appropriate to be able to memorialize that in the follow-up report, and that way it can also go into the city clerk records acknowledging what the history was.
That would be great, and particularly if there's legislative intent that we can identify. Because I assume there are some logical thoughts behind that, but I don't know whether at the present time that would prevent us from including a few additional charitable organizations that aren't umbrella organizations. So at least I think we'd want to be able to give that consideration.
Yeah, and there is concern about we want to be consistent in reviewing such requests from charitable organizations as far as eligibility.
Right. So certainly if they're not eligible under our current regulations, we can't make an exception for one organization, as notable as it is. But I think at the same time we may want to review those standards and see if they should be updated.
Yeah, and the City Council just approved in 2010, I have the date here, the Public Safety Committee and the Council approved the new rules that the Board of Police Commissioners developed for approving these organizations. So that was actually heard in Council very recently.
But it wasn't with a review of what our basic standards were in terms of umbrella organizations, I suspect.
Yeah.
I don't recall having any of that discussion.
Right. I can't speak on that. I don't know. I looked at the council action on the police commission rules.
Okay, well, if we could bring all that back in a report, that would be great.
Okay.
And when do you wish to have the report back?
What's a reasonable period of time, do you think?
In a year? No. Post-ERIP in a year.
60 days? 30 days? How quickly do you think that could be done appropriately?
Probably 60 days would be better.
All right, we'll bring that back in 60 days. Thank you.
Thank you.
And now we are adjourned.